A very good evening from Richardson Hospital. Here we have a patient with us and we are right now standing in the OR, and this is right before inducing the anesthesia. So he is a case of a post-traumatic deformity. Now why I call it a post-traumatic deformity is post-traumatic because he had a road traffic accident in 2017, and before that what he says is his face was absolutely all right, but after the accident, if you can appreciate the asymmetry, there is also just look straight. So you see this eye has gone in a bit, the malar bone, the projection is depressed on this side. So basically we are going to today work on his orbit. We are going to do an orbital reconstruction surgery. Now the reason we have shaved his head is we are going to do a bicoronal approach, meaning we are going to place incision here. The advantages of that incision is that it is scarless and it will be hidden by his hair. It will be on the scalp, and we are going to raise the flap all the way down here so that we get, he's already had a previous surgery before. He's having, you know, a protruding screw here, right here. So we are going to remove all of that and place and reconstruct the orbit. This patient also has blurry vision in the left eye. I mean, he's able to see, but it's a bit blurred. We will not be addressing that issue, but again, if at all there is entrapment of any muscles, that can be corrected. But we do not expect any functional visual outcome from this surgery because this is a very old case back in 2017 and we are now in 2021. So today what we are going to do is orbital reconstruction through a bicoronal approach. The scar will be well hidden beneath his hair, and this surgery will take about 2 hours or anywhere between 2 to 3 hours.
64 kg.
120. Any focus?
So I'm going to open at the same place so we don't give him two scars. We're going to be working around the left eye. So the main issue is the left eye, the left zygomatic bone, and then you can see the nose. So the nose is deviated badly. He's also having breathing issues. We're going to address all of this today. That we have not removed because that will give you a depression in the frontal bone. So that's why I've removed all the hardware in the nose from here. I've added some more hardware there, software. Okay. So see, aspect of this full thing, this thing, and the nose. As much as possible, we've done. Okay. I will tell you rough percentages. The forehead part has come out pretty good. The nose has come out pretty good, more than what we expected. Probably like normal. The eye, we made the height the same. So the eye was down, the eye was small, and the eye had moved towards one side. So we lifted it up. We've increased the size, but probably it's not come up exactly in the center. So the third part, because this eye was totally smashed. I've done some onlay and everything, so it's going to be significantly better. Now it's all edema, okay? But if you see already the eyes like really moved up and it's tight, and with time that will all come down and so there'll be good improvement. See, this is all some, you can see something is a little loose, all will heal up, shrink. And for 12 hours after such a major surgery, you're doing very, very well. A lot of my patients of such big surgery, the eyes can't be opened. So I don't want that to happen for you. swelling can increase up to 48 hours, but I hope it doesn't happen. But if it increases also, understand swelling increases up to 2 days, then decreases. So you're still in the increasing part of the swelling only, but for the moment it's pretty less what swelling you have for the surgery that we've done. Alright? Everything went off well. I mean, I didn't. If you couldn't move it before, you're not going to be able to move it even now. It's going to be the same.
There was kind of a numbness over there.
It will not improve. Numbness, these are all nerve related. So because you had a very major accident, some of the nerves were all damaged earlier itself. So that I won't be able to do anything with. ಕನ್ನಡ ತಮಿಳ್ ಊಟ ಕೊಡ್ಬೋದು ಊಟ ಅವ್ರಿಗೆ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಚೆನ್ನಾಗಿ ಊಟ ಕೊಡ್ಬೋದು ಓಕೆ ಬಿಕಾಸ್ ಬಾಯಿ ಒಳಗಡೆ ನಾವು ಕೈ ಏನು ಮಾಡಲಿಲ್ಲ ನೋಸ್ ಮಾಡಿದ್ದೀವಿ ಐಸ್ ಮಾಡಿದ್ದೀವಿ ಫೋರ್ಹೆಡ್ ಮಾಡಿದ್ದೀವಿ ಕೊಡ್ಬೋದು ಅವ್ರಿಗೆ ಏನು ಬೇಕು ಕೊಡ್ಬೋದು ಸಿಸ್ಟರ್ಸ್ ಹೇಳ್ತಾರೆ ಫಸ್ಟ್ ಲಿಕ್ವಿಡ್ ಡಯಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಆಮೇಲೆ ಸ್ವಲ್ಪ ಸ್ವಲ್ಪ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಆಯ್ತಾ
ಲಂಚ್ ಕೊಡ್ಬೋದಾ
ಅಷ್ಟು ಹೆವಿ ಇಲ್ಲ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಫಸ್ಟ್ ಇಡ್ಲಿ ಸ್ವಲ್ಪ 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 ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಒಂದೇ ಸಲ ಕೊಡ್ಬೇಡ ಫ್ರೂಟ್ಸ್ ಕೊಡ್ಬೋದು ಸ್ವಲ್ಪ ಅವ್ರಿಗೆ ಕಾಫಿ ಬೇಕಾದ್ರೆ ರೂಮ್ ಟೆಂಪರೇಚರ್ ಕೊಡ್ಬೋದು ಆ ಥರ ನಾರ್ಮಲ್ ಡಯಟ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ಬೋದು ಬಟ್ ಜಾಸ್ತಿ ಬೇಡ ಆಲ್ರೈಟ್
ಈಗ ಮೆಶ್ಶಿಂದ ಏನು ತೊಂದರೆ ಆಗಲ್ಲ ಸರ್
ಆಗೋದಿಲ್ಲ ನೋಡಿ ಅದು ಬ್ರೈನ್ ಮೇಲೆ ಇಟ್ಟಿದ್ದಾರೆ ಅವರು ತೆಗಿದ್ರೆ ಬ್ರೈನ್ ಎಕ್ಸ್ಪೋಸ್ ಆಗ್ತದೆ ಅದಕ್ಕೋಸ್ಕರ
So there was no 2 layers.
many areas just open. I have taken a full video of that. So ಅದು ತೆಗಿದ್ರೆ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತದೆ ತೆಗಿಲಿಕ್ಕಿಲ್ಲ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾರೆ ಏನು ಪ್ರಾಬ್ಲಮ್ ಮಾಡಲಿಲ್ಲ ಅಲ್ಲಿ ಜಸ್ಟ್ ನಿಮಗೆ ಆಕ್ಸಿಡೆಂಟ್ ಭಾರಿ ಸಿಕ್ಕಾಪಟ್ಟ ಮೇಜರ್ ಆಗುವಾಗ ಅಷ್ಟೇ ಮಾಡ್ಬೋದು ಅವ್ರಿಗೆ ಒಂದು ಸಲ ಅರ್ಥ ಆಯ್ತಾ ಇಲ್ಲೆಲ್ಲ ಕೂಡ ಒಳಗಡೆ ನೋಸ್ ಒಳಗಡೆ ಇಷ್ಟು ಒಂದು ಪ್ಲೇಟ್ ಈ ಥರ ಹಾಕಿ ರೇರ್ ಆ್ಯಂಗಲ್ ಅಲ್ಲಿ ಫಿಕ್ಸ್ ಮಾಡಿದ್ದಾರೆ ಅವ್ರು ಪಾಪ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾರೆ ಏನು ಕಂಪ್ಲೇಂಟ್ ಮಾಡ್ಲಿಕ್ಕೆ ಆಗೋದಿಲ್ಲ ಆಕ್ಸಿಡೆಂಟ್ ಆಗುವಾಗ ಮೇಜರ್ ಆಕ್ಸಿಡೆಂಟ್ ಸೊ ನಾವು ಆ ಥರ ಅದು ಏನು ಹೇಳಿದ್ರು ಅಷ್ಟಿಂದ ಬೇರೆ ಬರುವಾಗ ನಾವು ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಸಿಗ್ತದೆ ಭಾರಿ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಸಿಗ್ತದೆ ಓಕೆ ಆ್ಯಂಡ್ ಯುವರ್ ರಿಕವರಿ ವಿಲ್ ಬಿ ಫಾಸ್ಟ್ ಆಲ್ರೆಡಿ ಡೂಯಿಂಗ್ ವೆಲ್ mouth is open so fat I told you 4-6 weeks but maybe in 2-3 weeks you're going to be fine.
A very good morning everyone. Here we have with us a patient who has had a post-traumatic deformity and we have done a post-traumatic deformity correction. It's been 10 days now since the surgery and we are very happy with the outcome. Firstly, this patient has already had a previous surgery after the trauma and back then they have some outside hospital. They have gone through the bicoronal approach. So the best incision is always through the existing scar and that's what we did. We also went in through the bicoronal incision. We placed it through the existing scar and it is all healed. If you could just focus here. I'll show you come this side. I'll show you the pre-op, so here you can see how the scar was and we went in through the same scar. It is healed well, it is day 10. We just removed the staples before taking this video, clean this area a bit. Also, so let me tell you what we've worked upon for him. There was a lot of frontal view. There was a dystopia that was present, meaning his right eye and left eye was not at the same level, not in alignment. So we've corrected the dystopia here. Also, if you notice in this picture there was a temporal hollowing. So here we've elevated this area a bit and got a nice symmetry on both sides. There is a little swelling, a little edema which should subside and more or less his face is quite symmetric and we are we were hoping this temporal hollowing is solved, so that is done. His dystopia is corrected, and also the nose to a certain extent. Let me just take off the splint and show you. Okay. So we have corrected the nose also a bit. Alright, so you can have a look in the mirror and you can see your pre-op and your post-op image. There was a radix osteotomy done for him. Show the frontal view. So here you see we have corrected this asymmetry right here. There was a little deviation to the right and that has been corrected. You can have a look in the mirror. So I'll be removing these sutures now, okay, that is left, and cleaning up this entire thing. So how do you feel after looking in the mirror? How do you feel?
I feel okay.
You feel okay?
But the thing is, the swelling has to come down. So later on, it will.
You will send us your photos?
Yeah, later on. That can be done.
Yes, surely. Okay. So that's it. This was a post-traumatic deformity case. We have done orbital reconstruction, orbital mesh placement in the left orbital floor, correction of the temporal hollowing with implants, and we have also corrected the nose by doing a radix osteotomy, and we are very much happy with the results, and we hope the swelling subsides and his face becomes more symmetric. Thank you.